What if I told you that your body already holds the key to releasing stress and trauma, a healing mechanism that's been inside you all along? It's called TRE, trauma release exercises, and when we pair it with modern understanding from polyvagal theory, we get a clear, science-informed picture of how the body can calm itself, sometimes without words. If you've been stuck in fear, hypervigilance, or shutdown, or you just want tools to regulate your nervous system, this video is for you. First, what is TRE? TRE stands for Tension or Trauma Release Exercises. It was developed by Dr. David Berceli. In simple terms, TRE teaches a sequence of gentle, body-led movements that safely activate a natural trembling or shaking mechanism in the body, what Berceli and others call neurogenic tremors. Those tremors are not pathological. They're the nervous system's innate way of releasing excess activation after a threat. TRE's goal is to let the body discharge stored muscular tension and nervous system arousal so the person can return to a calmer, more regulated state without necessarily having to recount or relive the traumatic event in words. How does that make sense biologically? Let's bring in polyvagal theory. Polyvagal theory, the short version. Developed by Dr. Stephen Porges, polyvagal theory reframes how we think about our autonomic nervous system. Instead of a simple sympathetic vs. parasympathetic split, Porges describes three primary adaptive states organized by evolution. Ventral vagal safe, social engagement. This is the state of connection, relaxed heart rate, soft facial muscles, capacity for social engagement and learning. When we feel safe, our ventral vagal system supports calm attention and connection. Sympathetic mobilize, fight, flight. When danger is perceived, this system gears us up. Faster heart rate, sharper senses, readiness to run or push back. Dorsal vagal shutdown freeze. When the threat is overwhelming or inescapable, the older dorsal vagal circuit can cause immobilization, numbness, collapse, dissociation, or shutting down. One more crucial polyvagal concept, neuroception, the unconscious detection of safety or danger. Our nervous system is constantly scanning environments and social cues to decide which of those circuits should be engaged, long before we have conscious thoughts about it. Okay, so where does TRE fit in? TRE and the nervous system, how the pieces connect. TRE targets the way the body stores stress, chronic contractions, especially in core muscles like the psoas. The series of gentle exercises brings the body into positions that allow an involuntary, low-frequency tremor to emerge along the spine and through the core. This trembling is thought to be an autonomic discharge, the nervous system completing a defensive cycle that was interrupted during a traumatic event. When that discharge happens safely and in controlled steps, it can reduce sympathetic hyperarousal and shift the nervous system toward more parasympathetic balance, in other words, toward calm. TRE practitioners often report reduced anxiety, easier sleep, fewer flashbacks, and a sense of greater bodily safety. Important nuance: TRE doesn't erase memory or make trauma disappear. What it appears to do, based on clinical reports and early studies, is reduce the chronic physiological charge that keeps traumatic memories triggering the body. That can make talk therapy and daily life feel much more manageable. Scientific evidence, short, honest summary. The research on TRE is promising but still early. There are pilot studies, case reports, and small trials showing improvements in stress, quality of life, and some physiological markers, like heart rate variability, after TRE practice in specific groups. Larger randomized clinical trials are limited but in progress. Researchers are actively studying TRE's effect on anxiety, depression, PTSD symptoms, and autonomic regulation. In short, evidence suggests TRE can help many people, but we need more large-scale, rigorous trials to fully map how powerful and consistent those effects are across different populations. Animals do this naturally, we used to too. If you've ever watched a dog or a deer after they escape danger, you may have seen them shake, shiver, or tremble. That shake-it-off behavior is common across mammals and appears to reset the nervous system after fight or flight. Wild animals seldom carry chronic PTSD in the same way humans do. One reason may be that they routinely discharge the high-energy activation by shaking and moving after threats. Humans also have that capacity, yet it's often suppressed by social rules, shame, or the way we were taught to hold it together. TRE is essentially a safe, guided way to reawaken that natural biological skill. What actually happens in a TRE session? What to expect? A typical TRE experience can be divided into phases. Preparation/grounding, gentle breathing, body awareness, and simple warm-up stretches. This phase helps you sense where tension lives and establishes a feeling of choice and safety. Activation, a short sequence of exercises, often 7 basic moves in TRE training, designed to fatigue specific core muscles and invite the tremor reflex to emerge. The exercises are simple, often done lying on your back with controlled leg positions. Tremoring/discharge. The body begins an involuntary, rhythmic tremor that may last seconds to several minutes. People report sensations like shaking, quivering, sighing, muscle waves, yawning, changes in breathing, or emotional releases such as crying. Integration, grounding again. After tremors subside, the session ends with gentle centering, breathwork, movement, hydration, and reflection. The nervous system is given time to settle and to register safety. Every person's tremor is different. Some will feel it strongly in the lower back or pelvis, others will feel it along the spine or in the legs. Emotional material can sometimes surface. This is normal. The body and the nervous system can hold memory and effect. When the physiological charge alters, feelings and stories may shift. Safety, contraindications, and important precautions. Please listen. TRE is powerful for many people, but it's not a one-size-fits-all tool. Here's a concise safety checklist you should treat seriously. Consult when necessary. If you have complex trauma, active psychosis, uncontrolled epilepsy or seizure disorder, recent major surgery, a serious cardiac condition, pregnancy, or a hernia, talk with a medical provider and a mental health professional before attempting TRE. Certified TRE providers and clinicians will screen for these issues. Start slow. The first experiences should be gentle and short. Don't push for long tremors or force anything. TRE is about letting the body choose and self-regulate. Forcing can increase dysregulation. Watch for dissociation. If you tend to dissociate, e.g., zoning out, losing track of time, feeling detached from your body, TRE may need to be paced carefully or supervised by a clinician. Be ready for difficult feelings. Sometimes tremors bring up sadness, anger, or memories. That's part of processing. Have a support plan, a therapist, a trusted person to contact, or a certified TRE provider, and stop the session and ground if you feel overwhelmed. Not a replacement for therapy or medication. TRE can be a helpful self-regulation tool or adjunct to therapy, but it's not a substitute for appropriate psychiatric care when needed. If during TRE you feel overwhelmed, slow your breath, bring attention to 5 things you can see, 4 you can feel, 3 you can hear, 2 you can smell, 1 you can taste, the 5-4-3-2-1 grounding. Sit up slowly, drink water, contact your therapist. Concrete benefits people report. Across clinical reports and small studies, people report reduced anxiety, better sleep, lower bodily tension, improved mood, increased body awareness, and sometimes fewer PTSD-like symptoms. Physiologically, some small studies suggest improved markers of autonomic regulation, such as heart rate variability, which is a biomarker for flexible nervous system function. Again, promising, not definitive for all conditions. How TRE is different from talk therapy and how it complements it. TRE doesn't require recounting traumatic events. For many people, that's a relief. Instead of retelling painful memories, they use the body's innate physiology to process and down-regulate activation. That's why TRE can be especially useful in early stages or alongside therapies like somatic experiencing, EMDR, or CBT. When the body is less charged, cognitive therapies often become more accessible and effective. Practical tips: if you want to try TRE, a gentle starter routine. Find safety first. Choose a quiet, private space where you won't be interrupted. Have water nearby. Wear comfortable clothing. Warm up, breathe for a few minutes. Do gentle pelvic and low back stretches. Tune into where you feel tension. Begin short. Consider 5–10 minutes of guided TRE with a certified provider or a well-reviewed online beginner session. Do not force trembling, let gentle tremors arise. Pause and integrate. After a tremor phase, rest, breathe, and reflect. Slow movement and drinking water helps. Track your response. Notice sleep, mood, anxiety, and bodily tension the day after practice. If something feels worse or overwhelming, stop and consult a clinician. When to work with a professional. If you have a history of severe trauma, dissociation, active suicidal ideation, complicated medical conditions, or you feel unsafe during self-practice, work with a certified TRE provider or a trauma-informed therapist. They can pace the practice, ground you, and integrate what arises. The limits and honest view of the science. It's important to be realistic. TRE has meaningful anecdotal reports and encouraging pilot data. Several small studies and case reports show benefits. Larger randomized controlled trials are underway. That means TRE looks like a promising tool for regulation and for reducing stress-related symptoms, but scientists are still mapping exactly who benefits most, how long gains last, and how TRE compares head-to-head with other therapies. If you're curious, consider TRE as one evidence-informed tool in a broader trauma-informed toolkit. A final practical note on integration. Real change tends to come from consistent practice combined with other supports, safe relationships, regular sleep, movement, nutrition, and therapeutic work when needed. TRE can be a bridge, something your body uses to lower the physiological charge so your mind can heal more easily. Over time, many people report they feel less on edge, sleep more deeply, and have a gentler relationship to strong emotions. Closing, an invitation. If you're watching this because you've been at a low point, here's what I want you to know. Your body has intelligence and capacity you may have forgotten. It knows how to move energy, to finish defensive cycles, and to come back online into life. TRE is one pathway to reconnect to that ability, a gentle, body-led method that honors biology first. If you decide to try it, do so kindly, slowly, and with the safety checks we talked about today. If you found this useful, I'll put trusted resources and research links in the description so you can read further and find certified TRE providers. And if you want a walkthrough of a gentle, very beginner TRE session for stress relief, with lots of emphasis on safety and grounding, say the word, I'll make a follow-up guided video. Remember, healing is not a race. It's a series of small, brave steps that your nervous system learns to take again, step by step, tremor by tremor, until one day you notice you are standing a little taller, breathing a little easier, and living with a little more space inside. You are not broken, you are whole in progress. Take care, and if this topic is close to home, please check the resources below and consider reaching out to a clinician for guidance.